Thank you for joining us for this special edition of KPBS News. I'm John Carroll. As schools and businesses reopen, it's been an eventful week when it comes to COVID-19 in San Diego, and already we've seen some setbacks. Let's start with the numbers. San Diego County is approaching 40,000 cases since March. We reached 700 deaths this week. Imperial County is approaching 300 deaths. With San Diego off the state monitoring list, many indoor businesses are back open in limited capacity. We'll have more on that shortly. San Diego State University began its fall semester just a week ago, but in-person classes didn't last long. That's because the university is now reporting more than 100 cases. Health reporter Taryn Meadow tells us that's led to SDSU taking quick and decisive action.
San Diego State University is hitting pause. The university reopened for online and limited in-person learning late last month. But Vice President for Student Affairs Luke Wood says confirmed and probable cases of coronavirus among students has it shifting to online classes only for the next 4 weeks.
We understand that there may be some frustration with this decision, but we strongly believe that this is the best decision for our entire campus community.
University officials say many students didn't actually set foot on campus, and those that did were mostly for health services. At least 100 potential contacts are quarantined, and students can continue living in on-campus housing during the next 4 weeks. The county's Dr. Eric McDonald says they're still investigating any links between the cases, but he pointed to off-campus socializing.
You should not be scheduling or attending social gatherings that are not essential. And the essential job of a student is to participate fully in education. And most of that is online. Again, if it's not an essential activity as a student, really, you shouldn't be doing it.
He says there haven't been any hospitalizations, but many students have had symptoms, and he expects the number of cases to grow.
We are not minimizing the potential impact of this. I want to be very clear about this. We expect the numbers to go up. This is a serious situation. I have no doubt, frankly, that this will go into triple digits. I'll just say that right now.
The university's shift comes at the same time officials are warning San Diegans against celebrating together this Labor Day weekend. Supervisor Nathan Fletcher called on the public to hold themselves accountable.
One of the most dangerous settings is indoor gatherings. It is house parties. It is folks who are gathering together in an indoor setting. And there really is no way for us to enforce that or prevent that other than the public's help and cooperation.
He says increases in case counts could trigger closures on businesses that just this week were allowed to reopen their indoor areas. Taryn Mento, KPBS News.
Another local university, UC San Diego, is once again at the forefront of efforts to find a vaccine for COVID-19. The school will recruit about 1,600 people for a new phase of clinical trials. UC San Diego is working with British company AstraZeneca on the research. Imperial County also plays a role in this effort. El Centro Regional Medical Center will recruit about 1,000 participants. That community has been hit especially hard. San Diego's clinical trials will start next week. The first day of school usually brings the excitement of new classes, teachers, and friends. But as KPBS reporter Joe Hong shows us, that social element is missing as San Diego Unified begins a new year virtually.
After months of planning, the county's largest school district kicked off its first all-virtual beginning to a new school year. While students, parents, and teachers at San Diego Unified were largely disappointed by distance learning when schools first shut down in March, students said other than some minor hiccups, the first day of school went smoothly.
And it went really well today.
Kate Chasen is a junior at Sarah High School. She attended a Zoom meeting for her AP English class today.
She went through what the class is going to look like, what her process is with it, with how class is going to be, her standards for us and for herself. And we kind of just went through the basics of the class. Students at Sarah High School are taking 3 classes this semester, half the usual number. But each class will cover a year's worth of material. I'm taking AP English Language Composition, which is already a very rough course to do for the entire year. I know my sister took it, a bunch of my friends took it, and they had a hard time getting through it even in a full year. And so I'm a little nervous. Apart from the academics, students are wondering if they'll make any new friends during virtual learning.
That's something my other friends are kind of worried about.
Nina Tipton is a junior at San Diego High School.
A lot of people make new friends and enjoy the new school year because they can meet new people that they haven't before in their classes. And that might kind of be an issue.
To prevent feelings of isolation in students, Chasen hopes that schools will better publicize the mental health services they provide.
A lot of students just don't know that it exists. And I feel like especially now when we're all in our own homes having to do schoolwork by ourselves, it would be a lot easier. There would be a lot more peace of mind to know that there are those people and there are those resources out there to help.
San Diego Unified has not yet set a date for when it would reopen physical schools. The district did announce last week that up to 12,000 students with special needs would come back for in-person learning as soon as late September. Joe Hong, KPBS News.
We have much more on the challenge for educators this week. KPBS looked at the digital divide for English learners in the South Bay. You can find that story right now at kpbs.org and the KPBS YouTube page. This week also brought a step forward for businesses that operate indoors, albeit a small one. Not everyone is happy with the new reopening guidelines. KPBS reporter Matt Hoffman caught up with those in the event and restaurant industry who say it might do more harm than good.
And the announcement from the governor was not enough.
San Diego County Supervisor Jim Desmond and some local business owners say new reopening guidelines has the state picking winners and losers.
The limitations on gyms of a 10% capacity and indoor dining to 25%. That's absurd.
Business owners say they can't survive at those levels,
which nearly guarantees the failure of many small businesses in the coming months.
Very few businesses can afford to survive at 25% maximum capacity. Actually, I don't know any, quite honestly.
Those in the restaurant industry say they've followed the rules, most recently moving operations outside, but some are questioning guidance from health officials.
We completely transformed our outdoor space, meeting all physical distancing requirements, and quite frankly, I don't even know why, because I don't think it's much safer outside than it is inside.
One gym operator says reopening at 10% capacity is simply unrealistic.
How am I supposed to bring staff back at a 10% occupancy when I can't even when you can't even turn on the electricity with 10% of occupancy?
Quite frankly, our industry is dying.
Event planners and others say they can fully reopen safely and just need a chance to prove it.
We can contact trace, we can test prior to these gatherings, and yet they're still not allowed.
Some say they're worried about staff members that have been laid off for months.
When it comes to their mental health, it concerns me because they're at home all day, not doing things that they love, which is serving people. They're making their money. Walmart, Target, all these giant industries. But I can't open my restaurant and provide a living for my staff that need me.
The aim of reopening should be to open and stay open.
County Supervisor Nathan Fletcher believes reopening indoor operations added with the unknowns of some schools restarting in-person classes is too much too soon.
Are we going to responsibly and safely manage our way through this in a way that not only protects people from the spread, but protects our businesses from having to open and close repeatedly? And I think that the path we're on is just simply not a wise one.
Under the new guidelines, San Diego still has a, quote, substantial spread of COVID-19. And while Desmond and some others want businesses to fully reopen right away, the state is moving forward with a staggered approach. Matt Hoffman, KPBS News.
Rent was due for millions of Californians on Tuesday. For those who haven't been able to pay due to job loss during COVID-19, a new website explains how the state is trying to protect renters. HousingIsKey.com is meant to explain to tenants and landlords who qualifies for eviction relief. Help is available through February. Governor Newsom says California's moratorium is more expansive and lasts longer than a national moratorium announced by the CDC. The new state law and that federal order can be a bit confusing. Max Rivlin-Nadler tells us how the two work together and why they won't stop all evictions.
The last-minute legislation from California was followed by a nationwide order from the Centers for Disease Control, making it much easier for tenants in California to stave off eviction. Between the two of them, any tenant in California who can't pay rent because of the financial or health impacts of the COVID-19 pandemic will be protected from evictions until at least January 31st. But navigating the protections, which include paying a minimum of 25% of rent from now until the end of January and filing signed declarations with your landlord, will still be a lot of work for renters.
I fear, Max, for people who are going to try this on their own and say, oh, well, I can do this.
With housing courts reopening this week, landlords can now bring new eviction cases. Social distancing requirements mean that the court is processing these slowly, but the Legal Aid Society of San Diego fears that landlords who for months haven't received rent and little relief from the state or federal governments will move aggressively to push out tenants.
What we've been seeing lately, which I never thought, that we would, is landlord attorneys who are being, in my view, not all, let me be clear, Max, not all, but some unscrupulous and trying to get around all protections and filing papers that are bad, should be thrown out.
The rules surrounding an eviction have also changed. Instead of just 3 days between a landlord giving a tenant a notice of eviction and their possible eviction, tenants now have 15 days. And landlords must provide them with the paperwork asking them if they're not paying rent because of the impact of the pandemic. The San Diego Sheriff's Department hasn't stopped enforcing evictions during the pandemic. Since March, sheriff's deputies have carried out 66 evictions, with 43 of those coming in just the past month. Prior to the pandemic, the Sheriff's Department says it was serving over 400 evictions per month. The Legal Aid Society of San Diego says it will have a website up on Friday, specially geared to renters in San Diego County looking to avoid evictions under the new law and federal order. Max Rivlin-Nadler, KPBS News.
When you think about San Diego, you might think of sun-soaked beaches, but agriculture is a big part of our community, contributing nearly $2 billion last year. Recently, I learned how farmers are innovating to stay productive and profitable in the age of COVID-19. Agriculture in California, a powerhouse of the state's economy, contributing $50 billion of revenue a year, much of it coming from industrial-sized operations. And when you think about agriculture in California, that's what a lot of us think of, huge operations in the San Joaquin and Imperial Valleys. But when it comes to San Diego, most farms are somewhere in between that and this.
We have the most family farms in the nation. We have the most small farms. So 69% of our farms are 1 to 9 acres in size.
The crop report shows the value of crops in San Diego County neared $1.8 billion in 2019. It hasn't been that high since 2014. But over the last several years, the acreage of farms has decreased. So why is the value of crops going up? Hannah Bay says it's because farmers here have gotten very good at adapting through innovation.
They're shifting their crops to really high-value crops. They're shifting their crops to ones that don't require as much water, as much inputs, and they're reaping those benefits.
It highlights the determination and the resourcefulness of all of the ag producers.
A big part of Agricultural Commissioner Ha Dang's job is to support county farmers. In the time of COVID-19, that has meant making sure farmers know how to keep their workers safe.
And we provided about over 97,000 N95 and also disposable masks to the growers for their use for their agricultural workers.
The partnership has worked. Unlike in the San Joaquin and Imperial Valleys, farm workers in San Diego County have largely avoided contracting COVID.
We are in a severe labor shortage, and it does nobody any good to not take utmost care of your employees.
Both Dang and Bay say the 2020 crop report won't be as bountiful as this one, thanks to COVID. But even then, Bay says the county's farmers continue to innovate to blunt the impact of the virus, to keep agriculture in the county blossoming for years to come. California has seen more than 700,000 COVID-19 cases since the first confirmed case in January. As Stephanie Elam reports, California's Latinos are feeling the brunt of the pandemic.
I get tired, I have to take breaks.
Each step for Jenny Ruelas is a challenge.
I have to walk around with an oxygen can.
She says her father's 38-year-old girlfriend, Karina Bonilla, contracted COVID-19 in early May. Then Jenny's father, Humberto Ruelas, got sick. And then Jenny did too. They all lived together with the couple's 5 other children. Within 4 days, Jenny says she had headaches, chills, a fever, and lost her appetite.
I kept feeling chest pain.
Jenny was admitted to the hospital first.
They have ice everywhere because they can't control my fever.
Within days, Humberto and Bonilla were admitted together. Jenny's dad in the room right next to hers.
They're not giving my dad longer than 24 hours. I lost it. I was so mad. I hit the wall and I was like, Dad, don't do this to me.
Within minutes, he was gone.
Even though he had passed already, in his facial expressions, you can see the pain. He was in a lot of pain. And that's the face I'll never forget.
8 hours later, Bonilla also died.
I can't wait to go home. I want to go home.
In California, Jenny's story is not an anomaly. Through August, the data shows that Latinos make up 60% of coronavirus cases and close to 50% of deaths, despite representing more than a third of the state's population. Why is the Latino population in California getting hit so hard by the coronavirus?
Latinos make really a very significant portion of what we would call essential workforce. We have very high rates of diabetes, hypertension, heart disease, obesity, smoking. There is some social disparities in terms of just financial opportunities, healthcare access and utilization.
But it's the agriculturally rich Central Valley of California where the positivity rate is staggering. In those 8 counties, the rate is about double that of the state, as many of the farming jobs come with increased risk of exposure to the virus.
So even within our very high risk, there's even higher risk there.
The California Farm Worker Foundation is now offering free testing at work sites. Additionally, Governor Gavin Newsom deployed 3 support teams to the region to boost testing and contact tracing efforts with social services support.
I know that sometimes you have 3 generations of families living in a 2-bedroom trailer, and so they don't have the luxury of self-isolating. It's about the contact tracing and providing the resources for them to take time off of work.
As for Jenny, while she no longer tests positive for the virus, she definitely hasn't recovered. The 31-year-old had a stroke.
For the people who think this can't devastate a family, what do you say to them?
When you go through what my dad went through, trust me, nobody's going to tell you what to do because you're not going to be here anymore.
That was Stephanie Elam reporting. The infection rate in California's Central Valley is coming down from where it was in July. Support teams there are spreading awareness about testing in both English and Spanish. An investigation by iNews source has found deaths at home are up across San Diego County since the pandemic began. Some of those deaths involve COVID-19 victims who received little or no medical help. iNews source investigative reporter Mary Plummer has this story on a family in San Marcos.
When Hector Navarro Lopez got sick, he went to a COVID-19 public testing site in Escondido. As he waited for the results, he sought medical care at North County Health Services in San Marcos for stomach problems and a high fever. But according to his wife, Noemi Arroyo Ramirez, the staff screening patients turned him away. He instead had a phone call later with a doctor. His wife says the instructions were to reach out once they had the test results. She says she did that, but no one called back. That was the last medical care her husband would get before he died of the coronavirus a week and a half later.
Nobody called me to let me know how to take care of him. Not the county, not the clinic, any doctor, nobody. Nobody told us anything.
At home in San Marcos, Navarro Lopez isolated in a bedroom. The couple's children went to a hotel so they wouldn't get sick. Arroyo cared for her husband, relying on what she learned from television, Google search results, and her own intuition.
He was okay. He don't have more cough, and he just had one fever in the night. 103 was the highest, and he took a shower, and I gave medication, like Tylenol for the fever. And he was okay. He was talking good. He was walking good. I asked every single time, do you feel okay? Are you okay? You don't have fever? You don't have, pain or respiratory problems? And he said no.
On May 27th, Navarro Lopez woke early, saying there was a problem with his legs. His wife called 911. She says he walked normally to the stretcher. It was the last time she would see him. He had 2 heart attacks and died on the way to the hospital. The clinic declined to comment on Navarro Lopez's care. In a statement, the CEO said they've been committed to caring for the community throughout the pandemic. County public health officials say people tested at public clinics are supposed to be contacted by public nurses with care instructions. Navarro Lopez's family says that never happened. Officials say hospitals are safe and urge residents not to be afraid to seek medical care. For KPBS, I'm iNews Source investigative reporter Mary Plummer.
That story was co-reported by iNews Source reporter Jill Castellano. iNews Source is an independently funded nonprofit partner of KPBS. It's an image that shows not just the reach of COVID-19, but inequities in our healthcare system. A California lawmaker made waves this week when she was forced to bring her newborn to the state capitol to cast a vote. Buffy Wicks represents an assembly district in the Bay Area. She was on maternity leave and had concerns about the virus. On Monday night, Assembly leadership rejected her request to vote remotely, saying she wasn't considered high risk of catching COVID-19. But just last week, the state Senate allowed remote voting after a lawmaker from Santee tested positive.
Was told that maternity leave does not qualify, that I'd either have to stay home and not vote or I'd have to come to the Capitol. There was kind of no good choice, it felt like. And so my hope is that coming out of this, it's a broader conversation around how we're treating our families, how we're treating our new moms.
By the end of the month, Uber will require some riders to take mask verification selfies. It only applies to passengers who have been reported by a driver for not wearing a face covering, and if the next ride goes smoothly, they won't have to do it again. Drivers are already required to take selfies to verify they are wearing a face covering before they can pick up riders. Movie theaters are among the businesses that are now reopening under state guidelines, but if you decide to take in a flick, it will be a very different experience than what it was pre-pandemic. At the Reading Cinemas in Claremont, you notice a difference as soon as you get to the box office. No cash allowed. The theater urges customers to buy their tickets in advance and to reserve their seats. Seating capacity is being held at 25%. Masks are required. Physical distancing reminders are everywhere on the floors. Surfaces are being sanitized between movies. But health experts say staying in enclosed spaces around other people is risky. The main concern is ventilation.
How much air is exchanged from the outside. We know from studies that places that don't exchange a lot of outside air, that the ventilation can make a big difference on spreading virus.
The manager at Reading Cinemas says they've taken every possible precaution to keep people safe. And he says movies provide a getaway from day-to-day reality that is its own kind of therapy. Local churches can once again welcome worshipers to indoor services. KPBS reporter Jacob Ayer shows us how one Roman Catholic church celebrated Mass this week with some restrictions.
Parishes in San Diego County, like St. Joseph's Cathedral, are now allowed to hold in-person services. Services must abide by social distancing protocols and are limited to a maximum of 100 parishioners.
Or now, instead of being outside in the sun and the wind, we can be more conveniently inside, indoors. And of course, it's more sacred. It's a sacred space, we call that, where we can come and worship together.
So we are grateful to God. We are to serve God.
Both inside and outside, the Mass is now very different.
Once they're in, they're supposed to sit 7 feet apart, unless they're family. They can congregate together. And then no singing, because they can pray, recite, but not sing because they say that might spread the bacteria. And then during communion time, they are to line up 7 feet apart, come forward wearing their mask at all times, and then receive communion only in the hand.
Churches can still have outside services, and Bishop Robert McElroy is encouraging parishes to continue to live stream Masses so that vulnerable communities are able to participate in exercising their spirituality.
Holy Mary, Mother of God, pray for us sinners, now and at the hour of our death. Amen.
For now, we're allowed to come back, and we rejoice with that because we can, again, more fully practice our faith.
The diocese also oversees Imperial County, which has one of the highest case rates in the state. McElroy said the diocese is waiting for that county to issue new guidelines on indoor services. Jacob Ayer, KPBS News.
A reminder for you, you can find that story and more at kpbs.org. We recently redesigned our Tracking COVID-19 page to make it easier to find the latest numbers, headlines, and our in-depth reports on the pandemic. To get there, just click the Tracking COVID-19 link on our homepage. You can also find all of our stories and past episodes of Evening Edition on the KPBS YouTube page. That is all for this special edition of KPBS News. I'm John Carroll. For all of us here at KPBS, thank you for joining us, and please stay safe.